14 days incubation. Is it enough? It was at the very beginning of the epidemic, but going forwards, the virus has mutated and adapted, and we saw it in China and Hong Kong when they stretched the SHN, or what we call the quarantine, to 21 days because they saw a signal the virus was adapting. You see, whatever we throw to it, even including a vaccine, the virus will try to adapt. And the key is to find this gap.
Indeed, it'll dodge and duck and weave and reinvent itself, et cetera, because look, that's what viruses do. We understand that. The current vaccines, though, Doctor, are you confident that they are able to handle the new mutations of the virus, or is the jury still out? One, and two, you know, for people who've already been vaccinated with whether it's Pfizer or Moderna, et cetera, in Singapore specifically, is it a foregone conclusion now that they will need, in, let's say, a year's time, a third injection, a booster shot, as it were?
Great question. Now, I think the vaccines still work, but we have two gaps. The first gap is that some people don't get effectiveness with the vaccine. So we're talking about at least 5% of that. And what you really need to do is to get a test to identify this. In that sense, it's actually antibody tests, or specifically an anti-RBD or neutralizing test. Anti-RBD tests would be like from Abbott or from Roche or Siemens. They can actually detect the neutralizing antibodies. And if you look at it, those people who have neutralizing antibodies will be able to block the virus. In other words, the virus is here, the receptor is here, and it blocks it, and you have effect. And we have those kits around, and they should be using it. The second point is that the amount of antibodies in turn will determine how much protection there is. And that's the quantitative aspect. If you think about it, if we could measure a person who has been vaccinated and you look at the quantitative titers and you realize that he may or may not be protected. If it's not protected, indeed, he goes for the third dose. But if he is protected, you are going to save that dose for the other nations, the other people who are starving, who are dying without a vaccine.
Yes. Dr. Leong, Singapore's reopening is well ahead compared to the global peers, but do these clusters in any way set back the official plan? And from a public health point of view, does it warrant the return of restrictions, even a delay of initiatives like the Hong Kong-Singapore travel bubble, through an abundance of caution?
Great question. Hong Kong, Singapore bubble, every time we try to plan for it, it blows up and bursts us right in the face. It's as if it is jinxed. Now, I'm not going to hold my breath waiting for the answer, because I think eventually Singapore will be able to overcome this just like any others. We have taken draconian measures. We're actually controlling it. Now, the second thing which we ought to realize is that these cases will find and weave its way through. And my greater concern is actually in the meetings which we are going to have and hold, and perhaps we can again use testing to try to find them. You see, Singapore survives on meetings and conferences, and when you have the meeting, it is potentially a risk of transmission. So recently, I'm going to bring to the audience here and the viewers here, as recently as just 2 weeks ago in Barcelona, they had a gathering of a large concert where people had a swab test done with a mask test given on entry, and that's factored into the ticket. They had their antigen testing, and that came out negative, and that became a passport to enter and participate. I think that's a great idea, because the antigen test is very good during the highly infectious period, the first 5 to 7 days. You find it, you remove them out of the picture, you have your meetings, and in turn, you have a safe, wonderful,